Hi, everyone. This is Jonathan Martin. I am the National Director of Programs from the American Liver Foundation, and I'd like to welcome everyone to today's webinar. Today, we are very pleased to partner with the University of Pittsburgh Memorial Center, or Medical Center, or UPMC, and particularly Dr. Ganesh, to provide valuable information about living liver donation to people who may be on a wait list or those who care for them. We're also thankful today for Tania McCoy, who will be joining us to provide a caregiver and advocate's perspective. Tania will share with us her experience in finding a donor for her daughter Kennedy and some of the strategies she used to help identify a living donor for her. And we also will be joined by Dan Martinson, who will share his story as a family member who was able to be a living donor. And I just need to advance the screen here. There we go. The American Liver Foundation is the nation's largest nonprofit organization serving people with liver disease. We provide a voice for patients with liver disease and their families through education, support, research, and advocacy. So before we get started, I just want to talk to you about a few things about some logistics on the webinar. I want to make sure that you're ready to participate. So if you look at the right of your screen, on the right-hand side, you should see a box where you can type in questions. If you can't see that box, click on the orange button, which should make it appear. Just type in your question in that box and send it when you're ready. Feel free to send us questions both during and after our speakers' presentations, either for the doctor or for our patient advocates. When you submit the question, if you'd like, tell us your name and city. And we'll try to get to as many questions as possible. However, please do keep in mind that if you have questions after the program, you can always call our helpline, the number of which will be displayed at the end of the webinar. So we're going to do a little poll here today to find out a little bit about who is participating in the webinar. So if we could launch the first poll question. The question is, which of these phrases best describes who you are? So if you could, everyone, just go to your keyboard and respond to these questions. Looks like we've got about 3/4 of you have voted, and we're going to close that poll now and share the results. Looks like we've got about, it looks like we're pretty evenly split: healthcare professionals, patients, caregivers, and other. So I'm assuming other is probably other family members or maybe people who work in the field of liver disease that aren't necessarily a healthcare professional. So let's go to the second question. The second question today is, are you or your loved one currently on the transplant waiting list? Okay, it looks like we are getting close here. It looks like about 15% of you on the call are on the waiting list, and 85% are not. So I'm going to probably assume that the people who answered no are probably the healthcare professionals and the caregivers. So the third question is, if you are, and if you're not on the transplant list, don't answer this question. If you're on the transplant waiting list, have you used any strategies to identify, or which of these strategies have you used to identify a donor? Okay, so it looks like asking family certainly is the #1 answer here, and then asking friends and using social media are some other strategies that people have employed. So today's webinar will go over some other strategies that you might find interesting and might be able to help you in planning for the possibility of a living donor transplant. So what I would like to do now is to go ahead and let's get started with Dr. Ganesh. And I will right now hand you over control of the mouse and keyboard so you can control your own slides. And you should have that, and you can go whenever you're ready.
Thank you, Jonathan. Thanks, everyone, for participating in this webinar. My name is Ganesh. I am a transplant hepatologist at UPMC. I'm also the medical director of the Living Donor Liver Transplant program. One of my major roles is to evaluate patients for liver transplant and assess their medical readiness for the same, and manage patients who are listed for transplant and help them access to early liver transplant through Living Donor Liver Transplant. I also evaluate the liver donors and ensure that they are medically suitable candidates. Liver transplant is indicated in a person when they have end-stage liver disease due to multitude of reasons and can no longer be managed medically. Though liver transplant is a life-saving procedure, 30% or more patients are not able to receive liver transplant at the right time. In my mind, it is time to shift the paradigm to living donor liver transplant. Why do I say that? There is a huge disparity between the number of available organs, and transplant candidates continue to grow on the wait list. In Asia, this problem is successfully addressed by living donor liver transplant. However, in the Western countries, the number of living donor liver transplant has not increased in proportion to the growing wait list, and the demand for the organs continue to rise, and the number of patients who die on the wait list is also continuing to rise. The importance to increase the existing donor pool is paramount at this time. There is a huge burden of problem, which is the mortality on the wait list. Just to give you guys an example of what that is 1 in 5 either die or removed from the wait list each year. There are approximately 15 to 17,000 patients who are listed for liver transplant, and approximately there are only 7,000 deceased donor liver transplants done in a year, and out of which only 340 to 350 living donor livers are done. 1,500 candidates are removed because they are too sick waiting for a liver transplant, and due to the organ shortage, over 2,600 precious lives are lost just in US each year due to that. Compared to 1991 to 2017, the number of deceased donor liver transplants have not gone up. However, the wait list is growing each year substantially, and out of the patients who are on the wait list, only 50% of the candidates undergo transplant after 3 years of waiting. And out of them, as I said before, only 3% are living donor liver. The overall waitlist mortality, as I said before, is very high, and depending on each center, it's anywhere around 10 to 28%, which averages around 17%. This does not include the patients who were removed because they were too sick. And like I said, there are only 40 to 50% of the patients get transplanted on the wait list after waiting for 2 to 3 years. There is a substantial mortality on the transplant wait list, and there is also a trend towards higher mortality among patients with a low MELD. Approximately 25 to 30% of patients lose their window of opportunity to receive the liver transplant at the right time and succumb to their disease. So, in my mind, I cannot stress enough that it is a high time that we shift the paradigm to living donor liver transplant to save lives. So we all talk about several options to expand the donor pool. And we have talked about regenerative medicine, xenotransplants, 3D printing. All of that is very good in theory. It is not prime and will take several years. And there is no liver replacement therapy like hemodialysis, which is available for kidney. So right now, living donor is the only and the most effective, safe, and proven way and major way to expand the donor pool. And this, I just want to explain the function of the liver for people who are not on the wait list and who are caregivers. As you guys already probably know, liver is very important to the body. It has several functions. When the liver starts to fail, it can impact your daily life and also impact other organ systems, naming kidney, heart, and lungs. There are several different reasons for liver disease, which we call either cirrhosis or liver failure. The most common causes in the United States are alcohol, hepatitis C, liver cancer, toxins, and non-alcoholic fatty liver disease. Liver disease can affect both children and adults. And so when we talk about living donor liver transplant, what is living donor liver transplant? Living donor liver transplant involves removing a small portion of a healthy person's liver and transplanting it into another person to replace an unhealthy and deceased liver. The recipient's liver segment grows into a whole liver in 10 to 12 weeks. So the liver Both in the donors and the recipients, the liver completely grows into full size and also it, in, regain complete function in 10 to 12 weeks. Liver is the only organ which can regenerate, and that's why living donor liver transplant is possible. Living donor liver transplants have been performed for more than 25 years with a huge success and has saved several lives. And I just want to talk a little bit about the benefits of liver donation and what allocation means. And for people who are on the wait list, you know all of this, but I'm just explaining to the caregivers. In the United States, the deceased donor livers are allocated to the sickest patients. How is that determined? This is determined by the patient's MELD score, which stands for Model for End-Stage Liver Disease. Once the patient is on the list for liver disease, for the liver transplant, the allocation is based on the MELD scoring system, which utilizes the patient's blood work. However, many of you know that the MELD does not accurately represent how sick the recipients are in approximately 30 to 35% of the patient population, since it does not take into account of several features of the patient's symptoms. For example, it doesn't take into account of high ammonia causing encephalopathy, fluid buildup in the belly, fluid in the lungs. It doesn't take into account of losing body mass, muscle mass, or deconditioning. It doesn't take into any of those features. So the allocation of the deceased donor liver, as you all know, is governed by the UNOS, which is the United Network of Organ Sharing. An increasing MELD score indicates increasing mortality, and MELD of 10 have a 3-month mortality of close to less than 5% as compared to 90% for those with a score of 40. The, the, the liver allocation is divided into local, regional, and national. But however, what is very difficult is that for patients who are much sicker than the MELD, the only option and early access for transplant is living donor liver transplant. So why is living donor crucial in saving life? One of the major advantages of the living donor liver transplant is that you can have a transplant before you become critically ill. It bypasses the liver allocation policy and the changes which we talked about. It also bypasses the long waiting period on the list and the disparities across the regions. And currently in our region, for example, the current mean MELD score is more than 30 to get a transplant. And as you all know, some of the patients who are on the list, that when the MELD score is higher, the patients are much sicker. They come to the hospital every other week to get admitted. And when you get a transplant when you're sick, your outcomes are not going to be that good. Transplanting patients now with a much higher MELD in many centers because of the organ shortage. Currently, the median time of waiting on the wait list ranges up to 2 to 3 years, and it depends on the blood type and also the region you're listed. And and additionally, the literature shows that the people who receive a living donor liver have better short-term and long-term outcomes. And one of the reasons for that is that they are receiving a transplant while they are somewhat healthier. So that's one of the reasons. So let me describe some other benefits of the living donor. So as I said, 25% of the patients can die or succumb to their disease and lose the window of opportunity to transplant. However, when we offer living donor liver transplant, it increases the recipient's accessibility to transplant, reduces their waiting list. It's an elective non-emergent surgery, improves their outcome. This is their only chance to life. Recovery time is quicker. Their post-operative course is much better because you're getting the transplant when their MELD is lower and you are at your best of your health. And there are also some immunological advantages for this. And the other advantage is that one less person on the wait list for the deceased donor liver when the other person gets the living donor. And also in my mind, giving is very gratifying. It's a huge opportunity to the family and friends and people in the society to make a huge difference and also save lives. They can inspire other people. It's an incredible gift of life they could give their loved ones. The liver transplant is the only curative, the living donor liver transplant is the only curative and life-saving procedure for patients with the end-stage liver disease. Mostly and also extremely important, especially in a competitive transplant region like ours, where getting an organ in a timely manner is becoming much, much harder. So in my mind, this is a huge choice. This is an option. Stop waiting and start living. Allows you to take charge of the situation. You donate life and save precious life. And this would make the patient and the family feel very empowered. And in my mind, living donor liver transplant is the time. This is the time to shift the paradigm. Think about living donor liver transplant, increased access to transplant. And just to shift the gears a little bit and talking about who could be possibly donors and talk about our team, just one slide on the criteria for becoming a living donor. So we used to think that the living donor should be biologically related. So the living donors do not have to be biologically related. They just have to be healthy between the ages of 18 to 55. They should not have any underlying conditions such as liver disease, heart, or any active cancer. They shouldn't be using any active drugs or any substance abuse. While most people are related to the recipient, it is not a requirement. We have seen friends and even strangers become living donors for patients. In fact, 50% of our donors are not biologically related to the donors. They are directed donors, and sometimes they are altruistic. More people want to help. There is a lot of kindness in the society. Donors can choose to be direct donors who are known to the patient or can be non direct who are anonymous donors too. Whether a directed or non-directed donor, all donors they go through a very specific screening and a complete workup in our institution. And if you need an unrelated donor, it's helpful to identify a champion who can help the recipient identify a donor. UPMC has a great Living Donor Champion program which offers strategies for helping to expand and leverage their networks to find a donor. Visit upmc.com/living donor champion for more information. This will be talked about more during this webinar later. So there are certain steps one needs to take in order to be a living donor. The first step to becoming a living donor is to contact our transplant center and one of our coordinators to schedule a screening process. The process will begin with a blood typing and with a history and physical along with the blood work to identify if you have any underlying conditions or serious medical issues that would prevent you from becoming a donor. And the donor would also need an imaging study, including a CT scan and an MRI, to look at your liver size, volume, and any other lesions. Further additional tests may be needed based on the results. Many transplant centers, including UPMC, also require that you participate in a behavioral medicine exam to confirm that you're able to handle the physical and emotional stress and changes associated with the liver donation. In addition to the transplant surgeon, the UPMC transplant living donor team has a transplant hepatologist, living donor liver coordinator, donor advocate, social work, nutritionist, financial advisor. All of them are there to help to make this process very easy for the donor pre and post surgery. Our living donor advocates specifically are there to help to make sure people are fully aware of what it means to be a living liver donor and answer any questions on how to donate the liver, explain and help people understand the benefits and risks of living donor liver transplant surgery, voice any concerns to the liver transplant team. If it is determined that you're eligible to be a liver donor, you can choose to proceed with the surgery, or if you have any reservations, can choose not to. At no time will you be pressured by the transplant team to make any decision about becoming a donor. This is completely a voluntary and willing and altruistic choice by the donor. And I also want to ensure that our living donor, we have an outstanding team of living donor liver transplant, of transplant surgery, nurse coordinators, social work, transplant physicians, living donor advocates, psych and behavioral medicine, inpatient team, ICU, nutrition and pharmacy, case management and fiscal, and several others with expertise in living donor related process, procedures, and operational part. Our living donor team is led by our Chief of Transplant Surgery, Professor of Surgery and Medicine, Dr. Abhi Humar, who is highly experienced, world-renowned, reputed, and incredible surgeon with vast experience in all transplant-related fields, especially in living donor liver transplant. And just a slide on what to expect during surgery. Prior to surgery, after being admitted into the hospital, the donors are met by the transplant surgeon and their team and anesthesiologist to address any questions. And during the surgery, which is around approximately 5 to 7 hours, which is done by Dr. Humar, And depending on whether the liver is donated to a child or to an adult, approximately 25 to 55 to 60% of the donor's liver would be removed, depending on the size of the recipient. And the second team of the surgeons operates on the recipient. And post-surgery, donors are typically discharged within 4 to 7 days and can return to performing simple daily activities. And patients, the donors follow with us very closely in the first week, the fourth week, and the 3 months, 6 months, 1 year, and 2 years. And we have a long follow-up of these donors, and we follow them very closely. And another slide on just, it is important to note that the surgery of any kind carries risks. When the donor comes in to meet with our entire team, we meet with their donor and the families, and we explain to them the risks involved. And some risk of the living donor liver transplant may also include blood clot, bile leak, infection, or bleeding. And we sit with them for an hour and talk about all of the risks entailed. And so these are some of the things I have for you guys. And I am going to turn the presentation over to Dan Martinson, who will share his perspective as a living donor. Thank you.
Dan, thank you very much for joining, or Dr. Ganesh, thank you very much for that. And I'd like to introduce Dan Martinson, who is sitting with us here at our conference room in New York, who will share his story with us.
Thank you, Jonathan, and thank you, Dr. Ganesh. Good afternoon, everybody. It is a great pleasure to speak to you all today. At this time, around 11 years ago, this month, my brother and I were actually preparing for our living donor transplant surgery. Earlier in the year, he had been, previous year, he had been diagnosed with primary sclerosing cholangitis, PSC. And at the time, we did not think he would have to have surgery anytime soon. His doctor had told him maybe 15 years down the road he might have to consider this. The disease was in its very early stages. But if you're familiar with PSC, one of the issues of that is that it creates inflammation of the bile ducts. And one of the possible outcomes of that would be cholangiocarcinoma, bile duct cancer. And a few months after my brother was diagnosed with PSC, we received the very shocking news that he had been, in fact, tested positive for bile duct cancer. And he went, in our case, we're in New York, and he went to New York Presbyterian Hospital, and his doctors recommended a procedure in which they would treat the bile duct cancer. Thankfully, it was caught in its very, very early stages. It's a very virulent cancer, very tough to treat, but his was caught at its very early stages. So their plan was to treat the cancer with both radiation and chemotherapy, and then move to transplant the liver and the common bile duct following that treatment. So that was the plan moving forward. And the challenge that faced everybody was that because Kevin's was at his early stages of PSC, his liver was still relatively healthy. Therefore, his MELD score was very low. And he would have been waiting an incredibly long time for a cadaver transplant. As Dr. Ganesh pointed out, the need for organs far, far, far surpasses the availability. So his doctors then presented the idea of living donor as an option, and he wasn't having it. He was not going to allow any of us to volunteer. We're very close family, 4 siblings, both have wives, obviously, and we had our own kids. I have 3 children. So at first he wasn't allowing that to happen. He was pursuing other options, which included a transplant with a compromised liver. And he would have had to move from New York to Florida or someplace within like 30 minutes to have that accomplished. Finally, after a lot of arm twisting by both my wife, his wife, myself, my brother relented and was agreed that we would go forward with the living donor transplant. So that began our process. And as Dr. Ganesh pointed out, the process for preparing for a living donor procedure is very detailed. As a living donor, you are asked many questions. You meet with, you have a coordinator, you have a psychiatrist available to you and your wife. They want to make sure that you're really fully prepared and understand 100% what you're going to be putting yourself through in terms of doing this. So in my case, I felt incredibly prepared and 100% informed. They must have asked us 500 times, do you understand what you're planning on doing? And the answer was yes, let's go, right? Because the time was of the essence. The idea that we needed to do this transplant before any cancer cells reappeared. So fast forward to Memorial Day weekend of 2007. My brother and I, our wives, and my parents, my brother and I's parents, who were 71 at the time, were at the New York Presbyterian pre-op area. My brother had to have because of his case of having bile duct cancer, he had to have an exploratory procedure in advance of the transplant, because if there was any cancer cells, they would not agree to proceed with the transplant surgery. So he went in first. About 90 minutes later, his surgeon came out, dropped her mask, and big smile on her face, and said, we're good to go. I went in. I think in our case, our surgery was a little bit longer, maybe 12, 14 hours. Now keep in mind, this is 11 years ago. My understanding is that the procedure has changed quite a bit and has advanced in many ways. Came out, found out that they had taken about 70% of my liver and put it into my brother, that it was a successful operation. And then our post-operative experience began. And as Dr. Ganesh pointed out, most people are in the hospital for 5 or 6 days. The other thing is, as a living donor, one of the advantages is you get real stitches. You do not get staples. They treat you very nice as a living donor. And so you're separated from each other. He was in one part of the same wing, but different rooms in a hospital. You start off, obviously, in intensive care after that, and then you move to a step-down room, and you will be very closely monitored the entire time. You are, in terms of pain, I don't recall a lot of pain, frankly, because A, they give you good pain medication, and as that weans off, your next, I'd say, days 3 and 4, maybe, uncomfortable. You are going through major abdominal surgeries. There's no, you have to understand full well what you're going through. But the great thing about that is that you have great nurses and caregivers around you. And in our case, our wives were just amazing advocates for us. They were with us the entire time. They actually lived at a dorm room at Columbia Presbyterian in the hospital, lived there at night, and were with us all during the day. They were amazing. Our nurses and our doctors were absolutely fantastic. As anybody who may have gone through surgery in the past, there's always a nurse who sticks out in your mind, and I still remember her name to this day. Her name was Bernice, and she was awesome. And she, during those couple of tough days, was the one who just made you feel like everything was going to be all right, and it was. So about 5 or 6 days later, I left. 6 daay later, I went home. I did experience one of the complications that Dr. Ganesh pointed out. I had a bile leakage. And so I actually left with a tube coming out of my abdomen with a little ball to collect the bile, which, by the way, is a beautiful rust-colored liquid. It's fantastic. So then you go home. And yes, the first couple of weeks, you're incredibly weak. It's your liver. It controls your body. So I had a visiting nurse who would come in and just check the dressing. About 8-9 days later, the bile leakage cured itself, and I went back into the hospital, and the doctor, actually our surgeon, took it out, and I moved forward. And again, as a living donor, my recovery period was approximately 4 months. I kind of went from Memorial Day to Labor Day. I had incredible support from the company I worked for. I worked for Nickelodeon at the time, and when I told my boss that I needed to do this, she was like, "Good for you. Don't you worry about a thing. Go get it." And I have to stress that having support from wherever you work is an important aspect of this. Support from your family is 100%. I had 3 children. My wife was just, you know, a warrior. She just said, you're going to do this and it's going to be all right. So during the first few weeks, you're very weak. You kind of start off with baby steps, literally. You are shuffling around your house, and you get tired very quickly. You have difficulty speaking. But as each week passes, as your liver regenerates, which is amazing that it's the only organ that can do that, you gain strength and take steps forward. So I went outside my house and I would walk, you know, to the next driveway. And then, you know, a few days later, I'm walking to a stop sign. A couple of weeks later, I'm walking around the block. And within 4 months, I was running a couple of miles a day, feeling perfectly great. The regeneration of my liver, when I went back, and as Dr. Ganesh pointed out, you are very, very closely monitored after being a living donor. I think my liver regenerated to about 88% of its original size. As my doctor told me, it regenerates the size that your body requires for it to work for you. So come Labor Day weekend, I was back at work. I apologize, that was my alarm saying I've just reached my time limit. But I was back at work, and I did lose some weight temporarily, which you could look at as another benefit. I lost about 25 pounds because you're not eating much after you're initially part of the surgery. But again, everything comes back, your strength comes back, and I'm happy to report that 11 years later, my brother is doing fantastic. He has a wonderful wife, 2 children. They live on Long Beach, on Long Island. Very, very full, active life, surfing every day, working, etc. We're both doing great. And if ever I can answer any other questions about being a living donor, please feel free to reach out to me. Be happy to do it. Thank you very much. Turning it back over to Jonathan.
Thank you, Dan. That is a truly inspirational story. And congratulations both to you and to your brother and both of your families. Now I'm going to pass the keyboard over to Tania so she can share her story about being a champion for her daughter, Kennedy. Kennedy, you should have control of the keyboard. Tania,
thank you, Jonathan.
Kennedy. Welcome.
And Dan, I'm so happy you and your brother are doing well. Hello, everyone. Thank you again for joining us. My name's Tania McCoy, and at age 1, my daughter Kennedy was diagnosed with an extremely rare metabolic disease. She was the 8th person in the world diagnosed with her disease. And it came to light that a liver transplant would be the best way to save her life. I chose social media in my search for a living donor for my daughter because that was my largest network of people. And I felt that the law of large numbers applied to this situation in my life. The more I was able to get the word out there and share Kennedy's story, the better chance I felt I had at finding a living donor for her. To my surprise, I had several people offer to get tested within just a few days of sharing my post of needing a living donor for Kennedy on Facebook. And Kennedy's donor ended up being a man that I went to high school with 20 years ago that I had not had contact with since, other than on social media. So it goes to show that there are tons of people out there who are willing to help, and the more you share your story, the better chance you'll be able to touch some of those people. Now, as a champion, I work with patients at UPMC, and my role is to help encourage people to be proactive and to explore all the possibilities for finding a living donor. So we put together some strategies to help you find your living donor. And as Dr. Ganesh said, the first step in that is to identify a champion. Identifying and appointing a champion, it can be extremely helpful throughout the process. A champion is someone who provides emotional support and takes the lead in finding and securing a suitable living donor. So one of the hurdles that we speak to people about is generally just sharing such a vulnerable piece of information about your life, and how that can be difficult for a lot of people. It can be difficult from a pride aspect, it can be difficult from a privacy aspect. But again, the more you share your story, the better chance you have to touch other people's lives and for them to offer to get tested and to find a match. So some of the ways that can help you and some of the strategies, again, I use social media. That's what worked for my situation. Facebook, Twitter, Instagram, and other social sites can connect you with possible donors. And again, you have a very large reach with these social media sites. So anyone who's familiar with Facebook, if you post something on your page and perhaps someone doesn't have the same blood type and isn't able to get tested, but they share your post on their page, your network just grew to reach all of the people that they're friends with. So it can grow very exponentially, very quickly. And again, the chances of finding a match increase every time that happens. Word of mouth is extremely important. Any time spent with someone is another chance to share your story, to let them know that you are in need of a living donor. Again, it's about touching people's hearts, and there are a lot of people in this world still who have a very big heart and would love the opportunity, as Dr. Ganesh mentioned, to help another human being, to help make a difference in someone's life in such a huge way. So sharing your story with anyone that you come in contact with can be very helpful. A lot of us belong to different social settings that we may not think about sharing our story in, such as recreational sports leagues. Perhaps you're in a bowling league or a basketball league. Different church groups and other community-based gatherings are also places that you can find a suitable donor. Again, it can be very difficult to put yourself in a vulnerable position like that. At the time that I was posting about needing a living donor for my daughter, who was 3 years old at the time that she received her transplant, that was very, very scary for me to put out there such a vulnerable part of our life. However, I knew that it was the only way to save her life, and that overtook any of the pride issues or any of the feelings of anxiety about sharing the story. And again, to my surprise, I actually had 27 people respond within that week offering to get tested. So that was amazing. So again, sharing your story is very, very vital to this process. Finding and identifying and appointing a champion that you feel comfortable with is also a very important part of the process. It can be a relative, it can be a close friend, anyone that you feel can provide that emotional support, and someone who will be proactive in posting different things if you choose to use social media, or who may come and speak at a social gathering to kind of, educate people about living donation for your behalf, on your behalf. That can all be extremely, extremely helpful. A lot of people are able to touch base with their families initially as getting tested, and that can be a great resource. But there are times, in the case of my daughter, her disease was metabolic, and so we were not able to have a related living donor for her. I initially wanted to be her donor right out of the gate, and that was not a possibility. So I was put into a position where I had to find an unrelated living donor for her, which was very overwhelming. I didn't know where I was going to even begin. And that's why we've found these strategies and brought to you today these strategies to let you know that there is a starting point for this, and that it will grow and grow and grow to the point where hopefully you will have several people like we did offer to get tested and find that match for you. So one of the big parts is, as the person in need of the living organ, stay positive, stay healthy. Your job is to keep yourself as healthy as possible, as hopeful as possible, and staying positive. And for the champion, also staying positive and hopeful, but really getting out there and sharing the story in the hope of touching someone's life and getting someone tested to find that match. So if you have any questions that you want to ask me during the Q&A portion, I'm happy to answer any other more personal questions about my journey with my daughter. She is doing great at this point. She is 6 years old now. It's been 3 years since her transplant, and she is doing wonderful. She is a spunky little 6-year-old now, and we still keep in touch. For a gentleman that I didn't have a close friendship with in high school, I do now have a close friendship with. And so we've actually gained more love and family in our life through this process in him. And so that's been an amazing part of this journey for us as well. So I wish you all the best. And if there's anything that I can do to help or you have any questions, please feel free to ask me. Thank you.
That's wonderful, Tania. Thank you so much. I'm going to take back the mouse, and we're going to go to our question and answer. Once I get this to move along with me here. Okay, so we're going to open it up for questions. We've had questions coming in almost right from the very beginning. I think some of them may have been answered, but I'm going to do my best to try to take some themes of some of the questions that have come through. And I want to start out with one for Dr. Ganesh. Does the specific liver disease that a person has impact the success rate or the outcomes of the living donor transplant?
No, not necessarily, Jonathan. Anyone who is a candidate for a deceased donor liver transplant or a candidate for a living donor liver transplant, and in fact, actually, for some of the patients who are not a candidate for deceased donor, we offer living donor, and we extend it to some of the patients who couldn't get the transplant on a conventional sense for a deceased donor. So in fact, living donor empowers to transplant patients who are candidates for deceased donor, and for other conventional reasons for other unconventional reasons where we couldn't list them for a deceased donor, we could offer it for those patients too. So there is nothing which would preclude living donor, which deceased donor may not offer. If anything, it actually, we have more options with the living donor as opposed to deceased donor. So there is no any particular disease which living donor transplant does not, the outcomes are any less from deceased donor.
Great, thank you. Another question that came in addressed specifically the cost of the testing to determine if someone is a match. Who covers the cost for that? How is that handled?
That's a great question, Jonathan. So the donors testing and all of their blood work and all of that is covered by the recipient's insurance. So that is a good question, and that comes up multiple times. So the testing, their hospital stay, their surgery, all of that is covered under the recipient's insurance.
Okay, great. And this question came up frequently. Your slide says that the range for a donor is between 18 and 55, but the question came in fairly frequently. How firm is that cutoff? Is that something that's based on your institution, or is that what determines that age cutoff, and is that flexible at all?
So that is in our institution, it is a very firm cutoff, and in majority of the institutions, I think 55 is the maximum age range. But I have seen that in a couple of other institutions, they can exceed a little bit more. But for overall, that is a firm cutoff. This means that, the implications are not only for the recipient, but it is also for the donor, because we also want to ensure that the liver can regenerate and that the recipient who gets the donor's liver, there is the ability to regenerate in the recipient's body. So that's why the age is a very pretty much a firm cutoff. It's not an arbitrary cutoff, it's a firm cutoff. And in our institution, 55 is the cutoff for the age, because the implication means for both the donor and the recipient, because we have to make sure that they are healthy and that the liver has the capacity to regenerate both in the donor and the recipient, and that they are able to recuperate after the surgery. So all of them, as we get older, the function declines. So we want to make sure that the 55 is the upper limit where they can donate.
Okay, thank you. Now, is it my understanding that some institutions do not do living donor transplantation? Is that correct? Because someone asked the question about being told that they couldn't get it at their institution, and also that that an institution mentioned to them that they don't feel as comfortable with the outcomes of living donor donation. Can you comment on that?
So, Jonathan, there's only a few centers in the U.S. who does living donor liver transplant, and many of the centers do not do living donor liver transplant because it's a very highly technical and intricate surgery, and there are only a few surgeons who are extremely mastered this, and our surgeon, the chief of transplant, Dr. Homar, is a nationally renowned surgeon. He's highly reputed, and he has done several of those living donor surgery, but not all the institutions are comfortable doing living donor surgery because it needs special training and a lot of experience, and it's a very highly complicated, intricate surgery, and and the patients and the donors choose a center which has done a lot of living donor surgery, and they choose a surgeon who have a lot of experience, like we do have in UPMC and also with Dr. Homar. So you are right in saying that only a few centers do living donor surgery, and many centers are not. They don't have the capacity or the ability to have living donor program, or the surgical mastery which is required to do the living donor surgery.
So if someone does not live in your immediate area, they can still list with UPMC if they're able to travel for the transplant. Is that correct?
Absolutely, Jonathan. In fact, we do get referrals globally, and we get referrals from across the entire country to our center, specifically to UPMC for living donor and also to Dr. Homar, because of the reputation of the living donor program, and also specifically for him. And we do get referrals from Florida to New York, and we also get referrals from outside of the U.S. to our Center for Living Donors. So they don't have to live in Pennsylvania or in Pittsburgh to get living donor surgery in our center.
Great. So I have a question for Dan. Did either of you have any specific complications after the surgery, such as ascites or any other issues that caused any problems for you?
Right. So as I had mentioned, I had the bile duct leakage, which again is considered one of the most common potential side effects. My brother, in fact, did have a longer road, and I would preface this by saying the surgery that we did was the first time it had ever been done before in terms of treating a patient who had angiocarcinoma in this fashion with a transplant. So my brother, and I can't get too technical with it, but he had a very, very persistent bile leakage, and he had to have a number of follow-up surgeries. And it wasn't actually until a couple of years later that it was really resolved. Dr. Cato at New York Presbyterian was able to find a way to solve that issue. So those, he experienced many more complications than I did.
Thank you. And back to Dr. Ganesh. You mentioned that there are blood tests and imaging tests that are done. Several people have asked, some specific questions about what are some of those tests. For instance, do people have to be the same blood type? What are they looking at in imaging tests to determine whether or not someone can be a living donor?
Sure. So we start with the basic blood type, and we also look at the liver function tests. We make sure that they don't have any hepatitis. We check the hepatitis serologies. We check for TB. We also get an X-ray and EKG. So those are some of the basic tests we do. Preferably, we want the same blood type, but even if they don't have the same blood type, we can do, we do ABO incompatible living donor surgery in our institution, but so that can be done too, but preferably the same blood type. And we get the CT scan to ensure that the liver does not have any fat, and also to make sure that they don't have any liver lesions. And the surgeon, Dr. Humor, we also get an MRI to make sure that the anatomy, and he looks at the bile duct and he looks at the vessels to ensure that he's able to remove the portion of the liver and he still is able to leave the enough liver for the donor, and also to look at the surgical anatomy, and so that we look at those things for the surgery. And we also do like a 3D imaging of the liver to look at the volumes of the liver, so that he calculates the amount of liver which needs to be taken from the donor. So this way, there is a formula so that the amount of liver which is left in the donor is enough to be regenerated. So those are some of the things we are looking for when we do look at the liver imaging, to see if there is any fat, and look at the anatomy of the bile duct, and also look at the vessels, and to ensure that there is no fat or any lesions or tumor or mass or anything else in the liver, and that the liver is very healthy in the donor, and to ensure 100% that that we are potentially using a good liver.
Okay. So several people have asked us about the success rates of the surgery and the rate of complications. I'm assuming that's going to vary from institution, and as you said, you want to go to an institution that has a history or a reputation for doing the surgeries. Is there someplace people can go to look at the for the data, the success rates, or the statistics around the surgery?
So they can go to SRTR. It's available for everyone to look at the outcomes of each institution, and they can look at our outcomes for the whole program, and they can look to see our 1 year and 3 year and 5 year. And especially in our institution, even though in the literature it notes that the complications, the cumulative complications of the living donor surgery in the last 25 years has been listed anywhere around mild is around 10% and moderate to severe is around 20%. In our institution at UPMC, because of the experience and the expertise we have, the cumulative complications in UPMC overall is less than or equal to 10%. However, all of this is available on the SRTR for people to go look at. It's not specifically for living donor, but they can look at the SRTR for each institution. They have all the numbers and the outcomes have been listed. And in our UPMC, we have not had any major donor complications. We have not had any donor deaths. And especially with our surgeon, the chief of transplant, Dr. Humor, he has had 25 years of experience of doing this, of living donor surgery. He has not had any donor death in his career. And so our institution has not had any donor death as a complication, which is very important and it's very good.
Can you just clarify what you're saying an acronym there? Are you saying SRTR? Is that what you're saying?
Yes.
What does that stand for?
It's a scientific registry, transplant registry.
Okay. That's great. So I have a couple of assistants that are in the room here writing questions and themes of questions all over a whiteboard, and it's pretty amazing to look at all the questions that are coming up here. So if someone has been a liver recipient for a living donor transplant, are they eligible to be a donor at some point in the future? That seems like a very specific question, but is there any reason why they would not be able to be a donor at some point in the future if they have received a liver?
Sorry, can you repeat that question again, Jonathan?
If someone has received a liver transplant, are they able to be a living donor at some point in the future?
So if they received a liver transplant, can they be a donor?
Yeah.
No, meaning if they're already a transplant candidate and if they received a donor, if they are a transplant recipients, no, they cannot donate a liver.
That makes perfect sense.
So yes, so sorry, Jonathan, the website they can go for is, they can either Google it. It's either they can Google SRTR or they can go to srtr.org, which is the scientific registry for transplant recipients. So they can either Google and say SRTR to go look for the outcomes, or they can say srtr.org.
Great, thank you. So we have a lot of questions about the insurance coverage, and you said before that the donors, the cost of the testing is covered. Are all costs for the donor covered, including recovery, hospital stay, any follow-up? And likewise, if the insurance won't cover the surgery for the transplant, will Medicaid or Medicare cover it?
Sorry, I lost you for a minute there. I think it's a connection. Can you repeat the question again?
Yeah, so you mentioned before that when we were asking about the insurance covers the cost, or I guess the recipient's team or,
yes.
or hospital covers the cost of testing for the donor.
Yes.
Does that? I'm assuming that also carries through for all of the costs for the donor for the screening, the surgery, yes. the recovery, and any other complications yes. that arise.
Yes, absolutely. It doesn't cover for their lost wages when they take time off from work and all that, but however, it covers their medical expenses, their hospital stay, and it also covers their surgery, all of those. And we have a social worker, when they come in for an evaluation, our social work, Emily, sits with them and talks about what is covered under their coverage, and all of those questions will be answered for, when they come in, they meet all our, different disciplines, and then Emily, our social work, is one of the person who meets with them for an hour and talks about all of that, like the insurance and the coverage and what's covered, and those questions will be answered by our social work. They are part of our Living Donor team.
Dan, would you like to add something?
I was just to confirm, as a donor, I never received a bill at all the entire process. So it was entirely covered by my brother's insurance, and they had an incredible team if there were any potential billing questions that arose.
Does public health care, Medicaid or Medicare cover transplants of this type?
Yes.
Great. Okay, well, we're down to about 4 minutes left. We have had a lot of questions, and we've tried to touch on at least all of the themes for the questions. There are some that have certainly not been, we haven't been able to get to all of them, but I just want to remind everyone that you can go to our helpline at 800-GO-LIVER, and our helpline specialists would be happy to try to answer these questions. We will look through the questions here. I think we have your email addresses. If you are on the webinar and have asked a question, we can look through and see if there's anything that we can answer for you. And I'm sure that people at the UPMC would be happy to help us try to get answers to those questions for you as well. So we will do what we can to reach out to you if we receive questions from you and make sure that you got what you needed. I am going to go ahead here and share some resources with you. Again, here's liverfoundation.org or our helpline, 800-GO-LIVER. Oh, and here's the website that Dr. Ganesh was talking about, Scientific Registry of Transplant Recipients, SRTR, srtr.org. You can also visit the UPMC site, livingdonorreg.upmc.com. Someone of the member of the transplant team will reach out to you if you post a question there, and you can also check out their Living Donor Champion program at the website listed here on the website. This is going to bring us to the end. We just wanted to thank everyone. Thank you in particular, Dr. Ganesh and Tania and Dan, for spending your time with us today and answering the questions. I think Megan sent out during the in the chat a web link to our website where people can go online and tell their stories. We would love to hear from you and hear your patient story, either as a living donor or as a recipient. I know we have some other of our patient advocates listening in today, and I would like to thank you all for participating as well. And again, thank you to UPMC for your support of this program and for everyone for joining us today. With that, I will let you know that this webinar will be available online probably in about 48 hours. And it'll be posted on, there'll be a link to it on the transplant page of our website. And we'll share it through our social media as well. So thank you all very much for joining, and have a great rest of your day.
Thank you, everyone. Thank you, Jonathan.
Thank you.
Thank you.
Thank you.